chose pediatric surgery specifically because it's a very unique population. They have a unique set of needs, and I particularly like working with families as a unit to care for their child and help them recover. I'm Dr. Charlene Dekonenko. I'm a general pediatric surgeon here at CHRISTUS Children's Hospital. My first career was in immunotherapy research. I used to help conduct clinical trials, and that's where I first started doing patient care kind of directly. And that's what really made my work worthwhile. I loved the investigative part, but working with the patients directly really was so much more rewarding than working at a bench. I learned that I could do both of those things as a physician, and that's when I made the career switch. I think a children's hospital has all of the subspecialties and resources that a child could need during their care. Not just surgery, but general pediatricians, radiologists. So it has all the resources specific to children, which are very different from adults. And then we have other specialty resources like Child Life that their entire goal is to make a child feel comfortable in a kind of scary situation, which not a lot of other hospitals, particularly adult ones, have. I also am a minimally invasive surgeon, and what that means is that I do surgery through small incisions and use instruments to perform the surgery. What I love about minimally invasive surgery, there is evidence that pain control is much better after surgery, and they lead to shorter lengths of stay in the hospital. I believe that improves outcomes for patients and their families. Almost 90% of the surgeries I perform are minimally invasive surgeries. San Antonio has always been home for me. I grew up here. I went through schooling all the way through college here. I love that San Antonio is a large city that has all the things that you would need, but still feels a little bit like a small community, a small town, and has a very humble population, which I love. My philosophy of patient care is to not only provide great surgical care for the child and the patient themselves, but also to incorporate the family. I think that's one of the unique things about pediatrics is you have to work with the family and care for the family as a unit. You're working together as a team. I consider family a very integral part of the actual medical team because you're all trying to work towards a common goal to get their child better.